The stigma of PCOS can sometimes be as difficult as someone who's been diagnosed with a diabetes or a hypertension. The root cause of polycystic ovarian syndrome is insulin resistance. PCOS is a genetically transmitted condition in itself. I was diagnosed with polycystic ovary when I was young. I was put on the pill because that's the easiest thing to do. Just put someone on the birth control pill for 15 years, 20 years. The birth control pill or the oral contraceptive pill, and I say this every single day, is the best and the worst thing that has happened to women's health. If your periods are regular, if you have had no issues with the fertility, your insulin levels are fine, if your AMH is okay, you probably don't have polycystic ovarian syndrome at all.
They'll tell you it's just stress. They'll hand you a pill and send you on your way. But the acne, the fatigue, the irregular periods, and the weight gain that refuses to budge. That's not just in your head. And for a condition that affects millions of women, most still don't know they're living with it. PCOS, Polycystic Ovary Syndrome. Hi, I'm Gayu Lewis, and this is the Gayu Lewis Podcast, where we do not sugarcoat anything when it comes to women's health. Joining me today is Dr. Priyanka Mehta, a Dubai-based gynecologist with over 17 years of experience, a patron member of the PCOS Society India, and one of the few women's health experts who truly believes in treating the root causes and not just the symptoms. She's helped thousands of women navigate PCOS, fertility conditions, and the hormonal chaos. And she's here to answer the questions no one else is. Because if you've been dismissed, misdiagnosed, or ever made to feel like you're overreacting, this one's for you. Let's get some questions answered. Dr. Priyanka, thank you so much for coming on the podcast. It's amazing to have women who look at not just treating, the symptoms, but actually looking at the root cause issues. So there are very few women health experts like you. So I'm very grateful that you're joining me on this podcast today.
Thank you, Guy. You really am honored and I'm very happy to be here. I've been following you on social media and, like-minded people, I think Instagram also does that. You kind of, see people who are having that same kind of approach, holistic mindset. And for me, it's always been a whole person approach. Even if you come to me for something which is a very gynecological symptom, I will not let you go till I understand why is this thing happening to you. Like women come to me with very simple issues like, vaginal discharge or itching or frequent thrush or fungal infections. But then I, look back, why is this lady having this infection? Is it high insulin level? Is it pre-diabetes? What's going wrong with them? And that's been my approach from the beginning.
Amazing. To address the elephant in the room, which is PCOS. We know that millions of women worldwide are living with this condition. And like we said, most of the women don't even know that they have it. What exactly is PCOS?
So this term PCOS was coined as early as 1935, which means almost 100 years back. Also, they were seeing that some women are either gaining weight and their periods are getting irregular. And then they also found that there are some, cysts developing or some kind of swelling in the ovaries. So polycystic ovarian syndrome itself is such a huge term. And whenever we say syndrome in medicine, it's a collection of symptoms.
Okay.
So the three most common symptoms or features would be periods get irregular, you start gaining weight, some women lose weight also, and also they start growing hair maybe on their chins, on their cheeks, which is called hirsutism, or hair where it shouldn't be, and they start losing hair from their top, which is like balding, right? That happens. So the most important thing is irregular periods, weight gain, either you have more hair on your face or you start losing hair from your head. And when we do an ultrasound, there could be cysts or fluid-filled sacs, as we call them. So the ovaries look a bit bigger.
Okay.
But actually, it is not just a problem of the ovaries. In fact, now there has been a conversation about changing the whole name of polycystic ovarian syndrome to a more metabolic syndrome or a polycystic metabolic syndrome, because the problem is in metabolism.
Okay.
The root cause of polycystic ovarian syndrome is insulin resistance. And that is something which, if it is not addressed early, I see so many women who now in their maybe 45 or 50s are coming to me that I was diagnosed with polycystic ovary when I was young. I was put on the pill because that's the easiest thing to do. Just put someone on the birth control pill for 15 years, 20 years. And they keep gaining weight. They're not able to lose weight. And then you know about the weight loss injections. Then they have tried that also. And they're in a confusion. And then when I just check their insulin levels, it's mind blowing. They're like, no one even told me to check my insulin levels. And you see it through the roof. And that is the root cause of polycystic ovarian syndrome.
Is this genetic? Because I'm assuming if someone has started their periods and has been diagnosed with PCOS, I'm assuming that it's not that they had a unhealthy lifestyle from beginning that caused the insulin resistance. Is it genetic?
Yeah. So again, absolutely. We all inherit a lot of good things from our parents, our grandparents. You're very happy to get that, that jewelry which my grandmother would have had and given it to you. But for good or bad, we also inherit the genes from our grandparents and from our parents. In fact, there is a grandmother's theory. So as a woman, when your mom was a fetus, in your grandmother's womb, her ovaries started making eggs. And you were one of those eggs. Okay. So that's how, if your grandmother had diabetes when she was pregnant, that means you would have got the gene of insulin resistance. And that means that, you could be having insulin resistance and pre-diabetes without even knowing it. So that's how PCOS is a genetically transmitted condition in itself.
Okay.
And if we, so I get young women in there, say 18 or 20-year-olds or someone who's just started university, periods are getting irregular. They're eating healthy. They say we do exercise, but I'm still having acne. I'm still gaining weight. My periods are not coming properly. And that can really freak them out. And then when you ask them, do you have any family history of diabetes? They're like, yes, my grandmom had it on both sides, or my grandfather had it, or my mom had it, diabetes. And then insulin resistance is the root cause, which is, of course, genetic.
I know I'm jumping too many questions, but I had to ask this. Is there a way to reverse this condition?
So the most important thing is to get the correct diagnosis. A lot of women nowadays are just looking, not even Google. Nowadays, ChatGPT is a new mantra. I have so many women who come and say, Doctor, ChatGPT recommended us to come to you. And I'm like, thank you. Let me feed more stuff to ChatGPT. So just having irregular periods doesn't mean you have polycystic ovarian syndrome. Please don't label yourself, because the stigma of PCOS can sometimes be as difficult as someone who's been diagnosed with a diabetes or a hypertension. So just because you have irregular periods doesn't mean you have PCOS. First thing, learn that. Another thing is there are some hormonal markers, like I do a test, anti-Mullerian hormone, which has been recommended by the guidelines that if your AMH, which is the egg count test, basically anti-Mullerian hormone. So if the AMH is very high, then it could be suggestive of PCOS, which means you have a lot of eggs, but these eggs don't mature. And that is how it could be polycystic ovarian syndrome. Then in the ultrasound, we have a very typical picture of polycystic ovaries, because your eggs don't mature. So they're all fighting with each other. They're all small and immature. So they kind of form a string of pearl appearance, as we say in the ultrasound. The ovaries will look like very small, tiny cysts or like pearls, in the edge of the ovary. So that could be one of the marker. And we also do your insulin levels. We check your testosterone. So unless you have either met a gynecologist or an endocrinologist and then done all these tests, your ultrasound, your biochemical markers, your hormone markers, don't label yourself as a polycystic ovarian syndrome. Now about the treatment or reversible. So basically, I can just give you a statement that there is no cure for PCOS, and that can shatter your whole body, right? What do you mean? I will never be cured with it. So polycystic ovarian syndrome, actually, like I told you, the name is wrong. It's basically a metabolic problem. So you have to manage it, and you have to learn what is the most bothersome symptom. Is it the weight gain? Is it my sugar cravings? Is it my not able to control what I eat? Or is it my irregular period? So based on your symptom, we kind of help you, handhold you, and we give you a whole range of options, and that's how we kind of manage it. So it's not about reversal, it's just about learning to understand what's going on with your body. Of course, love your body, and then keep your blood levels and your markers in the normal range, and it can be as normal as anybody else.
Can you have PCOS and still have regular periods?
Yeah. So if you have because of whether you know it or not, knowingly or unknowingly, maintained a very healthy lifestyle. You are in the lean PCOS category because there are 30% of women who are also, they don't have a very high BMI, but they could have PCOS. And the only problem is your ovaries don't make egg because periods will happen sometimes. Just going back again to the menstrual cycle, we have 4 phases.
Yeah.
You have your periods for the first 3 or 4 days. Then the phase is called follicular phase, where you make a hormone called estrogen or estradiol. And then the ovulation or the egg comes out in the middle. Then you have the luteal phase, where the progesterone is released. And that is, if you don't get pregnant, you get your period. But it does happen for some women. They only make estrogen. They don't make the progesterone. The estrogen keeps building the lining. And after 25 or 28 or 30 days, they shed the lining because there is no progesterone to hold it. And they could be having a regular cycle. They may not make the egg, but they could be having a regular cycle, and they could also be having PCOS. That is where PCOS and a lot of hormonal conditions sometimes are like that story of the elephant with 5 blind men, right? So if you just look at one part of it and you don't meet both a gynecologist and an endocrinologist and check all your blood levels, which are important, you could just be doing a quick fix for yourself. And that is why in my consultation also, I try to give you at least 45 minutes to an hour, because I want to understand what do you do in your life? What time do you wake up? What time do you sleep? If you're not sleeping early, is it because it's your habit, or is it because you're not able to fall asleep? Because if you don't have enough progesterone in your body, which happens in PCOS, you may not be able to sleep. Or is it your work pattern that you are doing late nights and that has caused polycystic ovary? So it's like a mini surgery for me when I do a hormone consultation, because I really need to know what you're eating, what stress you have in your life, how you do your things, what are your relationships like. And that is where, you don't fix just your periods or just any one part of what's going wrong.
Amazing. The women body, I think, is so complicated.
Yeah, women are supposed to be complex, and I'm so happy that only women can do that.
Is PCOS, you spoke about insulin resistance being one of the main, but can it be caused by lifestyle?
Of course, it can be. So there are different types of PCOS. There are actually 4 kinds of PCOS. I will not go into too much of medical detail. But there are the types of polycystic ovary. The phenotype means how you look externally. So there are women who are lean, and they could have polycystic ovary. There are women who are also having obesity, the BMI is higher, also who can have polycystic ovary. And like I said, even periods can be normal, but you could have the polycystic ovarian syndrome. So how lifestyle affects us, for me, I tell women about the 4S when I start talking about the treatment. And the 4S is my simple way of telling anyone who comes to you that I'm doing the test for you to understand where you are, but my treatment is very simple. Right? I don't tell them lifestyle, which is important. I tell them salt and sugar, cut down, stress and sleep, manage it. All right. So these are my 4S, which they remember that. So in terms of your sleep, like the best time to sleep is by 10 and 11. But if you do a survey, how many of us are actually in bed at 10?
True.
Right. And the reason for the sleep is that your body makes cortisol, which is the important hormone we need in the morning to wake up. Like, I needed to come to see you today means I should be up and about and I should have done my other things. So cortisol is essential for life. Our body makes cortisol after 10 and 11. That's the time, midnight, when we should be sleeping. But if you're awake because of either you're on TikTok or if you are having a night duty, so you're awake on most nights, your body is not making the cortisol, or it's using up all the cortisol. In the morning, you have no cortisol.
Okay.
Now, progesterone is the precursor of cortisol. So as the hormones are made, cholesterol makes pregnenolone, this makes progesterone, and progesterone makes cortisol. So naturally, when you don't have enough cortisol, all the progesterone moves to make the cortisol, which is essential for life, because periods are not essential for life. So that's the thing that's get hit. And this is actually called the pregnenolone steal syndrome or the progesterone steal syndrome. So that's how, the hormones for women are really complex. And if your lifestyle that's how lifestyle affects it. Or if you're having a lot of sugar and a lot of salt, right? So we are not looking at what we're eating, right? We are very happy gobbling in protein bars or taking a lot of shakes because we want to build muscle. But I just tell women, just look at the ingredients. Totally. In fact, now with my eyes, I'm not able to read well, right? So reading glasses is important, or use a magnifying glass and just look at the ingredient. So any product will say, no added sugar. and you are very happy, right? You have a lot of these zero options and all, which, okay, there is no sugar. But if you look at the ingredients, it will say 1 gram of this product contains 4 grams of sugar. So sugar is going to be there. So if you're consuming anything from a packet, that is the sugar you're taking in, right? So I even tell women that I then want to know, are you eating a lot of, are you eating a lot of smoothies? Are you taking a lot of juices, right? People think orange juices are healthy, but you are actually going to take 4 oranges, dunk in all of that, drink it very quickly, and that's a load on your liver. So all these are the lifestyle issues, cosmetics. So we really should know what we are applying on our face, on our body, wax candles, you have scented candles, you have all these perfumes and all that you're using. So all these chemicals also contain endocrine disruptors, which means these molecules can go into our body, can mimic our hormones and confuse our body, and that can again lead on to all these problems.
You spoke a lot.
I know.
Amazing. I mean, there was a lot of download of information into my head at the moment. You spoke about, again, like saying that lean women can have PCOS. And I think I can put myself in that categories. I would say I have never been on the obese side. BMI has always been balanced. And I have got PCOS. Never had irregular periods. I think my periods have been my best friends. Didn't have fertility issues also. But I have PCOS, maybe genetic. My grandmother probably gave it to me. My question is that why do I still have PCOS with no symptoms? And why am I still tagged as PCOS?
So that's why I would not tag you as PCOS, because I would like to explore that how you got this tag of PCOS. Was it your insulin level which was high? Or was it a high AMH? Or was it ovaries which appeared polycystic? Or was it a difficulty in conceiving? Because someone would have tagged you as PCOS for some reason. So I would like to know, how did you get tagged as PCOS?
One of a gynecologist during one of my ultrasound told me that you have PCOS. There are cysts around your ovary. You have PCOS. But I've always been going and asking that. But I've never had issues. Like I said, periods regular.
So there is something called polycystic appearing ovaries. So the good thing about polycystic ovarian syndrome is that because you have a lot of eggs, you also may have a later menopause. Your testosterone levels are high, so that again helps you with all the benefits that testosterone gives you. So ovaries which appear polycystic on the ultrasound is not the same as polycystic ovarian syndrome. So maybe I can shatter your label today that if your periods are regular, if you have had no issues with the fertility, and if your insulin levels are fine, if your AMH is okay, you probably don't have polycystic ovarian syndrome at all. Your ovaries may appear polycystic. So polycystic appearing ovaries on ultrasound is not polycystic ovarian syndrome. So please don't just go by a label which is put on you, because like I told you, really polycystic ovarian syndrome means there's a lot of hormone imbalance. So when we check the levels also, I always love to check your progesterone levels on day 20. Because progesterone is like nature's sleeping pill. It really helps you. And if you don't make any progesterone, that's when you don't get the periods. That's when you keep gaining the weight. And that's when you're feeling all the different things that you feel like. It's like you have PMS every day because you don't have progesterone. So without those biochemical markers, I never label anyone on PCOS. So there's a lot of girls who come to me very lean, just period is irregular then and there, 18-year-old, and she's confused because she's met multiple doctors. Someone has said you have and you don't have. I said, okay, do you want a shortcut or do you want a correct answer? And then she sat down. No, I want to know. I said, okay, at the age of 18, let me just suggest 2 tests. So I do the AMH test and the insulin resistance. And when she did her insulin resistance, the insulin levels were more than 1,000, which is like the normal range goes from 6 to 100, right? And it is like really high. And that's when she understood that, okay, there is insulin resistance. I am also having irregular periods. And then the ultrasound is not showing polycystic ovarian syndrome because the ovaries don't look polycystic. But this could be polycystic ovarian syndrome. So 3 criteria are there and 2 have to be fulfilled for you to be called as a PCOS, which means ovaries which appear polycystic in the ultrasound. You should have an evidence of anovulation, which means your periods are irregular, either coming early, late, or heavy. And the blood markers, which are showing that your testosterone is high, or you have clinical features of high androgens, which means hirsutism. So of the 3, 2 criteria have to be fulfilled But like I said, this is again evolving because they want to change the name itself of polycystic ovary. So it is going to be an enigma, and it is going to be like women are a bit complex. But doing certain tests and trying to understand how your lifestyle is, how you're feeling is more important than sitting with the label and, feeling that, okay, I've got this thing and it's really crippling my life.
Oh, thank you. You've opened my eyes today and told me something I don't have. You also spoke in the start that, when women have PCOS, doctors generally prescribe them metformin or birth control and told that your problem solved. Continue taking this for 17,
Forever.
18 years or forever, or stop it only when you need to conceive. Is this the only treatment possible?
So the birth control pill or the oral contraceptive pill, and I say this every single day, is the best and the worst thing that has happened to women's health. The best is because oral pills have a lot of benefits. Women who struggle with irregular periods, heavy bleeding, PMS, acne, it really helps regularize the cycle. There are also studies which say it helps reduce the risk of ovarian cancer, endometrial cancer, and so many other benefits. But, and also contraceptive. It's a very good effective contraceptive. I myself was on the pill for many years. But if you're looking just at a polycystic ovarian syndrome and you're just giving a pill and not fixing the other things, that means mostly women who have PCOS, when do they know they have PCOS? When they have irregular periods.
Correct.
Whom do they go to for that? To the gynecologist. The gynecologist in the 5 and 10 minute consultation gives you a Yasmin or a Yaz or an oral pill and take it for 3 months, 6 months, forever, or just blindly start you on a glucophage, which is metformin, all right. But what should ideally be done is, like, look at the insulin levels, as I told you. There are, and then of course I will tell you, do your exercise and lose weight and come. That is the worst thing you can tell somebody, because you cannot just lose weight and come when you have high insulin levels, because your body, and unless you don't know that, you really don't know what to fix. So the lifestyle part again involves weight training, adding more protein, and there are also supplements which can help reduce your insulin levels, like inositol, berberine, maybe vitamin D is less, magnesium. So they all have to work together. And there are also, like I told you, so glucophage is a way which reduces insulin.
Yeah.
Supplements can also reduce insulin. And we also give bioidentical hormones, which are the hormones which are the same, which we are giving in menopause also, which we give during pregnancy also, right? Just that the name bioidentical has kind of become like a mantra now. But we have been giving progesterone during pregnancy for ages, almost 25, 30 years now. So women who have either had an IVF pregnancy or they've had some kind of pain or bleeding during pregnancy, we put them on different kind of progesterones because it helps to keep the uterus calm.
Okay.
So the similar hormones can be used even in polycystic ovaries. So you don't have to put everyone who has polycystic ovaries on the birth control pill.
What are the pros and cons of the pill? Does it have side effects in the future?
So yeah, you can take birth control pill for 5 years and 10 years also. Like I told you, a birth control pill is not going to cause breast cancer. A birth control pill, in fact, there are studies, it prevents the risk of ovarian cancer, cancer of the lining of the womb, endometrial cancer. Also, it is helping your periods to come in a regular way. You are not having heavy bleeding. I've seen women with really low hemoglobin because they've been having a lot of abnormal bleeding. So birth control pill help in regularizing the cycle, and it's an amazingly effective contraceptive also. So in that ways, you can use it for as long as you want to. When you stop the pill, you can get pregnant also. It may sometimes take a month or two, but it is not going to suppress your fertility. So there's just a lot of fad going on that the birth control pills are the very bad, So it's quite safe, can be used. But if you don't need contraception and you're looking for other options for your PCOS, then there are other options, hormones available. So that's not the first medicine which I give to, say you have a young girl who's not looking for contraceptive, then I just give her the option of a glucophage or a inositol berberine plus the lifestyle change, and put them on a progesterone just for some part of the cycle, say for 10 days or 5 days, so that they at least start getting their periods. Okay. But if you want a birth control also happening at the same time, then you can use a contraceptive pill. And some women I also top up with additional progesterone, because the birth control pill is going to suppress all your natural hormones. The whole purpose is you should not ovulate. So some women don't feel very happy, but they want contraception. So then we just add on a bit of progesterone in the luteal phase or in the second half of the cycle, so that they don't get that PMS, and we have to take it as the symptoms come.
Oh, so it's like an orchestra that you have to play with
It
all.
is tailor made. It is not a cookie cutter approach. So you have to, that is why it has to be very individualized. And you have to also then keep checking your levels of your insulin and, working towards that part of the treatment.
Very exciting job you have. Talking about lifestyle, you spoke. I'm a health coach, so there are a lot of diet fads in right. There's keto, there's dairy free, there is. Then of course you've got the whole gluten free, which helps a lot. I've had Dr. Marlene speak about how it helps with endometriosis in
Definitely,
general.
yeah.
And then intermittent fasting. I'm a big believer. Currently doing a 72-hour fast as we speak. It's very confusing for women, especially with PCOS. They're trying to lose weight. Which of these, is there one of these specific ones that will help them, or it's a mix and match? Or again, what suits me, and what suits you?
Absolutely, yeah. So again, I will go back to the insulin resistance, which means that if what happens in insulin resistance is whenever we eat food, our body always wants to, as say I eat an ice cream, which has a glycemic index of 100, because all foods have a glycemic index. So insulin levels are going to increase. Insulin is a hormone made by the pancreas. This is a small organ behind our tummy.
Yeah.
Okay, we don't see it. When you have insulin resistance, your body has stopped listening to that insulin. So the levels have to go higher and higher for the glucose, if whatever you have eaten, to go into your cells.
Yeah.
And as the insulin levels increase, this increases your inflammation also. That's why foods with low glycemic index are better for polycystic ovary. So that's the first thing I tell women. And I tell them, please don't call it a cheat meal. Call it a treat meal. If you worked hard, if you're fasted, if you have done exercise, like if I love a particular food, I try to earn it. So I will do what's little extra weight training. I'll probably do an extra 10 minutes of cardio so that I can earn that meal. Because in polycystic ovary, the high insulin and the whole sugar craving which happens because of that, what happens is if I want to have a cookie, I will go eat one cookie. But someone with PCOS, because their brain is telling them you should not eat, you have craving, you should starve yourself, they will not eat, wait, and then go up and up eating 5 cookies.
Yeah.
Right? That's what happens. And then feel more guilty about it and eat 5 more.
Yeah.
So that guilt and all of these things that you are gaining weight and, so the best diet for me is a diet which is not restrictive. I believe too much fasting is not good for women's hormones. So fasting, of course, is amazing. So what I tell the women who come to me is keep a eating window. Same thing as intermittent fasting. I call it time restricted eating. Like, all right, don't eat after 9 p.m. Try to just, if you're really hungry, maybe have a fruit. So don't starve yourself. And eat when you're hungry. So we are probably eating a lot, right? But when you restrict too much calories, so there are women who will only do keto or they are just taking a lot of fat. And then when you totally restrict calories, then they end up in severe constipation, and then that can have its own side effects. So listen to your body. Of course, a meal plan, a nutrition plan helps you to get, kickstart the whole thing. And especially women are taking the weight loss injection route, right? GLP-1s, which are also amazing if you are stuck with a high BMI, if you're stuck with this body weight which is just not melting away. And it's frustrating. I've seen women who come, doctor, I'm doing exercise, I am tired. So I tell them, don't exercise every day. Right? Exercising every day is also killing you. You're not enjoying the process then, right? So your food and your calorie, like keep the calorie restricted, but don't totally cut down on calories. And keto protein, of course, look at the quality of protein that you're taking. Go as natural as you can. And that's my mantra. Like no restriction. Even you want to have dal chawal, go ahead and have it. But first fiber, then your protein, and then your carbs. So in fact, I carry a lot of food to my hospital, and I sometimes just keep all of that displayed on my counter that please eat this, and they are like, okay. Or in fact, one patient, they gave me a box of finger millet, foxtail millet, and the pearl millet, and then the oils also. So I in fact displayed it for a few days on my my desk that this is what you should eat, right? So it's about just finding choices. And again, our brain is used to comfort, isn't it? When you're a working woman, there is no time to plan very elaborate meal plans and follow it for long. So it has to be simple, practical, it has to be doable. And if you're with your whole family also. So what I do in my family is I just introduce things, like the atomic habits way. So like if you're having, so I'm from Delhi. But I got married in the South, so I'm both, I love South Indian cuisine more, in fact. So if you're making dosa, I add a bit of ragi, so no one knows what it is, that's the millet. Or if you're having a chapati, then I add a bit of jawar into it. Or if you're having rice, then you kind of add, or we try to make these millets, biryani and things like that. So you just kind of add in the foods and, kind of make the whole process enjoyable. That's my mantra. But intermittent fasting, yes. I wish I could do longer fasts. In fact, during Ramadan, we all fasted properly, and I really felt that my brain worked much better. You're much sharper when you're fasted because, like, you go into ketosis, and you're that's when you're also burning fat. So it has to be a balanced approach. That's what I believe. And for gluten and dairy, yes. So I'm a Punjabi myself, but I can see now I tolerate rice or even millets better than gluten. So maybe my gluten is restricted and not that much, but I haven't had any bloating or any kind of gut issues. But you just kind of see that your body is not different from how you were. Like the so-called fast food, if I'm ordering pizza also for somebody, maybe I'll just have a slice because I don't want to, it's not that I'm restricting myself. Now you feel your body so pristine, you don't want to just put in whatever is called junk. So you want to just balance and stay healthy.
Yeah, but not everyone is in that frame of mind as well, right? When you see a pizza, you're like, let's just eat the pizza today.
Yes. So how I then tell women is that, okay, you want to go your weight loss journey, you enjoy, keep maybe 5 days of more plant-based diet or whatever you're having, add more plants to it, eat slowly, eat without the phone, because that's what happens, right? If you and me are having a meal together and a conversation, we actually eat less. Because that is what that whole leptin and the satiety hormone is talking about. Why are weight loss injections so popular now? Because it's an easy way of not feeling hungry, right? But you're actually losing a lot of muscle also.
Yeah.
And you're also not feeling hungry. You're not taking a lot of food inside. So at some point of time, you will have to stop the injections and then your lifestyle has to take over. So it's just the whole, I just tell women, just give a minute because your brain is more sensitive to the smells. So that's where when we go to any of the fast food joints, right, the French fries and all of that smell really pulls you towards you. But if you just give a few minutes and then you see an apple and donut, which is better for me, give a few minutes and which is better, maybe you will choose the apple.
Yeah, I mean,
And enjoy your donut also.
There's not a few squats after that.
Yes.
What kind of exercise is actually beneficial for women with PCOS? You spoke about strength training, but cardio generally puts a lot of stress on us, of course, increases cortisol production more, then, of course, holding on to the famous belly fat in general. Is it the same with PCOS in general, or is it different with women with PCOS?
So again, I think weight training is something we should introduce. I encourage my daughter also, who's 18, you should come with me. We've started wearing weighted vests during our walks because weight training ultimately builds muscle. Muscle is a big sink for glucose. So it could just be starting with 15 minutes walk after every meal in which you are, so most of us after a meal, we just want to sit down and end of the day, you deserve your phone time and all of that. So walk and talk or just have a 15 to 20 minutes of walk after your meal so that your whatever you've eaten goes and sits inside the muscle rather than going into your fat and make this fatty liver. Strength training, of course, is important whereby under supervision you start just with 2 or 3 days and it could just be just 4 reps, keep going heavy. Like I tell women in the perimenopause also that weight training, of course, helps burn your fat in a better way because you're converting the lipid or the fat into muscle. So I always tell women, okay, please don't lose weight. That's the first thing. I'm not telling you to lose weight. I'm not telling you to eat less. You have to eat more, but get your body composition analyzed. And once they see the percentage of fat and then they look at the muscle percentage, so building muscle will only happen with the weight training. And that's where then they start shedding.
Okay. You spoke about weight loss injections and then, of course, building muscle. And we know the fact that with the weight loss injections, muscle loss happens because the body is going to start looking at different sources from where it can get energy. Muscle being easier to burn as compared to fat. But these injections are becoming so popular. A lot of people are taking it even without any prescription, without seeing any endocrinologist, It's easily available. For a person who's affected by obesity or diabetes, I understand it could be a game changer for them. But what about people who are misusing it? As a health professional, what's your take on it?
Yeah. So there's been this new fad of microdosing, right? So usually these injections, as whether it is Manjaro or Ozempic or Wegovy, there are even oral medications available. So anyone who comes to me, I usually see them with my endocrinologist. So I just tell them, see, the injections may be covered in insurance or not. You can get them over the counter. You may get it from your own country where it is cheaper, no problem. But have the endocrinologist in the loop, because they will monitor your insulin, your cholesterol levels. Also, they need better to do an ultrasound of your thyroid before you start it, and also your full abdomen ultrasound, because there are studies where there is a risk of thyroid cancer or a pancreatitis infection, which is rare, but it's a good idea to start with the baseline and see where you are. All right. The dose also needs to be monitored by someone who is experienced, and the self administration, again, what happens is people take it, then forget it, take it, then don't take it. So the weight goes up and down, and this is real, metabolic risk, because you can actually cause more damage by taking something without supervision. And it's always better that I am for the GLP-1s, absolutely, if you are in a higher BMI range and you need to kick that 10 kgs or 5 kgs or 15 kgs and feel good about yourself. But when you reach the goal that you need to reach, and even during the process, if you're not doing your weight training and not being wise and mindful of what you're eating, you're actually doing more damage. So you cannot expect that, like hormones, the injections to do everything for you. So you will just gain all the weight back and even more if you're not, changing the whole mindset and the lifestyle.
Okay. So we spoke about, PCOS, and I want to talk about more than, physical symptoms. PCOS affects mood. It affects the confidence of women. How can women deal with PCOS on a more emotional level?
Yeah, I've had women who are in their, say, mid-30s. They have had polycystic ovaries before, then they had pregnancy over fertility, because that is a very important thing. Even 18-year-olds, when they come with the diagnosis, the first thing the mother is asking is, oh, she's got cyst in the ovary, will she get pregnant, how things will be. I've had people who've had relationships gone awry because they've said that, okay, you have PCOS, maybe you won't get pregnant, so they don't want to marry a girl with that. So these kind of stigma and these kind of statements can really do a lot of damage to a girl's mind. But even in later in life, when the fertility part is over, or if you are, you're just, the first thing is, if your periods are not happening in a regular way, that itself, creates havoc for a woman, isn't it? Because you don't know when your period will come, how it's going to come, is it going to be heavy? And they're always worried and concerned about it. Then the important thing is the social media also. We want the best selfies, we want the best pictures. So one tiny pimple or one tiny thing on your face means that's it. Women are going crazy with that whole thing, body image. Belly fat, right? We want to go to size 0. We want to always be looking thin. So the mental part and the brain fog. So brain fog also happens, like I told you, because there is no progesterone. PCOS is progesterone deficiency. It's high time we label these conditions in a very clear manner for people to understand, right? Because otherwise women just don't know what's happening. So you have no progesterone, you will not get your periods. Often some women have to be on some kind of progesterone medication, even if it's for 5 days in a month, so that they at least get their period and they don't get this PMS or a premenstrual syndrome kind of, because mood swings can happen, right? So women have come to me saying that I'm just getting angry for no reason and I'm not able to sleep. So this lack of sleep again happens with progesterone deficiency. So it's everything just going back and forth, and the whole stigma of, am I going to, and then when they look on either your internet, then they get all the complications, endometrial cancer, diabetes, hypertension, heart disease. So addressing both the mind issues and also how they're, how they look at themselves. So that is very important. So a lot of positive self-talk, not only from the family side, and also, sometimes parents can themselves, mothers can do a lot of harm.
Yeah.
Because, they will just say, oh, you're lazy. It's not that they're lazy. It's just that ovaries have also become lazy, and the motivation is just not there because of all these, hormonal and metabolic disruptions. So that very sensitive and non-judgmental approach is needed from the family side also. So I actually call all the stakeholders. Okay, mom, dad, brother, sister, everybody come.
Let's have a coffee together.
Let's have a coffee. Let's discuss what's going wrong, and let's just help enhance this little kid's life, right? Don't just put the stigma on them that and already they don't eat well in college and university, and then when this PCOS happens, then they just stop eating totally. So that really, and then they eat more when the cravings
and
happen.
then the vicious cycle
Yes,
is there.
yes.
I'm a menopause coach, and you spoke about PCOS and the whole hormonal roller coaster. Question is, if someone has PCOS, how is their menopause journey? Is it similar, or would there be more issues later?
So with PCOS, like you understand, for me, I think all women and girls, if I could do that, so I have made a little guideline for myself, which I share with everyone. From the age of 20 or 25, everyone should have their hormones tested, thyroid antibodies, insulin levels, because that is when the disease starts when you're in your 20s, all right? So in your 30s, someone with PCOS would probably, who is maybe completed their family, they don't want children anymore. So a lot of women just say, we don't get the period once in 3-4 months, it doesn't bother us, but they keep gaining weight and the lining of the womb gets getting thicker and thicker. So when you have PCOS and you don't get a proper period, there is a risk of endometrial cancer and hyperplasia, which can happen in their 40s. So that is something women have to remember in terms of gynecology. In relation to menopause, because naturally you have not ovulated enough, you do have more eggs which are there. I mean, there is no study which has kind of said that, okay, if you are PCOS, you're having a very late menopause. But usually your testosterone levels are higher. So they kind of have, some of them have less symptoms. But if you have obesity and if your weight is high, then you could be struggling with that. So each journey is different. But on the whole, women who have PCOS, because they have irregular periods, so then sometimes they don't know that they're in a menopause also. So that also happens, that their periods are far and few, and no one even tests for them. That, okay, that's normal for me, and they just keep going on with it. But it's very essential for women to get their hormones tested at least once a year. At least do your ultrasound once a year, whereby you look at your uterus, the lining of the womb, and your ovaries, how they look, so that you just know that, where you are in terms of your health.
Amazing. Doctor, this brings me to the last segment of our podcast. I call it the 1%. 99% of our conversation is about women, but men are a part of our lives too. What is your 1% advice for the men in our lives? What can they do better to support women?
So men, in fact, in my consultation also, when I see a woman who comes on her own, I'm like, okay. But when her partner comes with her, the whole thing changes. Because for me, I tell men, see, I cannot be at home with your wife to help her take the medicines or to remember to do the exercise. So you are kind of my hand, you're my partner in this. So that once she goes home, because she has to do a couple of tests, she has to be doing her exercise, she has to do a lot of things. So that support which men can give in terms of, okay, I'm here for you, you're not in this alone. This is a journey we are doing together. So that can really, so that can be a game changer for women. Because when they feel that, okay, if I am not getting my period regularly, if I'm gaining weight, there's nothing that I'm not doing about it. It's not my fault. So then when they do things together, even things like exercise, right? If you have someone who can just come with you, then you take them. So that's where, men can really support women.
Yeah, it'll be an accountability partner.
Absolutely.
Doctor, any parting advice to the women who are listening, who got diagnosed or they feel overwhelmed? What would be your 3 non-negotiables for them?
So non-negotiables for anyone for that matter is get your health check. So we do a lot of things to our body outside as women, right? We want to make sure our hair are looking good. Then there are so many things we can do for our face, our body, what we wear. But on the inside, we really don't know what's happening. So as women, your breast cancer screening, similarly your ultrasound for the uterus, your hormone tests or something, that once a year, just visit a doctor, just like in maintenance, annual maintenance, just do that. Another thing is just watch what you're eating, because often we do a lot of, emotional eating too. Like if you haven't had anything the whole day, then you think you can eat whatever you can. So even after the fasting, like if you're doing a 72-hour fasting, I am sure you will still be wise enough to see what you're eating after that. So for me, fiber, protein, and then the carbs. So that is something I just look at in terms of the food. And the third part is just, I think, enjoy your life, because we have one life, right? So just enjoy your life. Don't put too many things in your head, overthinking, looking at the internet, looking at the diagnosis. Just get a consultation from any doctor whom you think is friendly and knowledgeable, and just get things sorted rather than putting all the burden of the diagnosis treatment on yourself.
Doctor, where can our listeners get in touch with you?
Yeah, so on my Instagram handle, you can send messages. There's also a lot of information on my the link also, where you can just see where you can find me. And I'm also available in the Canadian Specialist Hospital for consultation. So very happy to help women who want to just understand what's happening to them. And I get a lot of women from the age of 18 to 80, really, who I have 70-year-olds who come and just tell me, okay, I'm menopausal, I've been reading a lot, can you do something for me, can you help me? So I'm here to help. Let's all live this life in a very healthy way together, and it's not rocket science.
Yeah.
It's easy.
Thanks a lot, Dr. Priyanka. It was amazing to understand PCOS in a much more broader term, and not to live with the stigma, and actually accept your body and do the right lifestyle changes. Thank you so much. It was great having you on the show today.
Thank you so much. I had a great time. I think we just spoke a lot, lot of information. So thank you so much.
Amazing. If no one's ever told you this yet, you are not lazy, you're not broken, and you're definitely not imagining it. What you're feeling is real, and you deserve answers that go way beyond Google and quick fixes. PCOS is complex, yes, but you are not powerless. With the right support, the right questions, and the right people in your corner, your body can become the place you can feel safe again in. If today's conversation made you feel seen, share it with a friend, a sister, or someone who's still searching for clarity. Because the more we talk about this, the more we break the silence, the stigma, and the shame. I'm Gayu Lewis, and this is more than a podcast. It's a movement for women who are done being dismissed. Until next time, menopause, why pause? Let's play.